Hello, and welcome to this short video on cholesterol. We're going to take a look at what cholesterol is and how high levels of bad cholesterol can affect our heart health, as well as how to manage it long term. Disclaimer: this presentation should be used for general information purposes only. It is not a substitute for specific medical advice from a GP, specialist, or other healthcare professionals and should not be used as such. For individual cardiac rehabilitation advice, please consult your local cardiac rehabilitation team. If you're experiencing any changes in symptoms, please seek advice from either a GP or specialist. In the event of severe chest pain or breathing difficulties, please dial 999. Aim of presentation: to understand what cholesterol is, to understand how it gets around the body, to know the targets for cholesterol, to understand how high levels of bad cholesterol can be harmful, and to look at ways of managing cholesterol. So, what is cholesterol? It may surprise you to know that only 40% of cholesterol comes from the fat in our diet. The rest is mostly made by our liver. We do need a certain amount of cholesterol, as it plays an important role in our bodies, i.e., it helps with digestion and building cell walls. It is only when we start to have too much bad cholesterol that it causes problems, clogging up our cardiovascular system and eventually leading to heart attacks or strokes. So, how does cholesterol get around the body? Cholesterol has a special transport system for reaching all the cells that need it. It uses the blood circulation as its road system and is carried on vehicles that are made up of proteins. This combination of cholesterol and proteins are called lipoproteins, and there are two types of these. Firstly, there are non-HDLs. These are sent out from the liver to the cells to do some important work. However, we class them as bad cholesterol because excess amounts can start to deposit on artery walls and cause a buildup of plaque. HDLs, or high-density lipoproteins, on the other hand, are what we class as good cholesterol, as they help to mop up the excess bad cholesterol and take it back to the liver. This slide shows you how cholesterol deposits build up to cause narrowing inside the coronary arteries. So now you may be wondering what your cholesterol target should be. If a person has established coronary artery disease, then a total cholesterol of 4 or below is the target level. Non-HDLs should be 2.5 millimoles or below, and your HDLs should be more than 1 millimole. Remember, HDLs are the good cholesterol, and the more of these you have, the better. Exercise can help to boost your HDLs. Please be aware that these targets may change over time, so to occasionally check any updates with your health professional. So to summarize, you want a low level of total cholesterol and low levels of non-HDLs and higher levels of HDLs. If you have high levels of cholesterol, you are far more likely to suffer a heart attack, as excess cholesterol deposits inside your coronary arteries and eventually builds up into a fatty material called atheroma. As the arteries become more narrowed over time, this can start to lead to angina symptoms and/or a heart attack. Please see our Understanding Your Heart event presentation to gain more of an insight into this process. There are a number of causes of high cholesterol. It could be genetic, otherwise called familial hypercholesterolemia, or FH for short, and there are specialist nurses who can screen families for this condition. Eating too much saturated fat is a common cause. Less commonly, there are some diseases of the thyroid, liver, or kidneys that can contribute to high cholesterol. There are also some medications that can be a contributory factor as well. As you can see, there are a number of lifestyle changes you can make to help keep your cholesterol under control. Healthy eating. It is important to maintain a healthy diet. Try to cut down on saturated fats, as these can increase your total cholesterol and your non-HDLs. Saturated fats can be found in cheese, butter, pies, pastries, crisps, cakes, biscuits, etc. And also, try to remove any visible fat from meat before you eat it. Try to eat more monounsaturated fats, as these help lower non-HDLs without lowering your good cholesterol. Try to include some omega-3 oils found in oily fish, such as salmon, mackerel, kippers, and non-canned tuna, as part of a general healthy diet. Stop smoking. Smoking damages the lining of your arteries, which can result in increased plaque buildup. Alcohol. It is important not to exceed the current guidelines of 14 units per week and to spread it throughout the week rather than saving it all up for one night. Exercise. It is important to keep active and/or exercise, as there are lots of health benefits to this, and it can also help boost your good cholesterol levels. If you have coronary artery disease, you should have your cholesterol checked at least once a year at your GP practice. People with more complex cholesterol may need to be referred for specialist intervention. There are a number of medications that can help control your cholesterol levels. The most common ones are statins, and these include atorvastatin, simvastatin, and rosuvastatin, amongst others. These are so effective, they can reduce your total cholesterol by more than 40% and LDLs by 30%. Statins also help to stabilize plaque within the lining of the artery. There are also other medications that can lower your cholesterol, and these include fibrates or ezetimibe. These can either be used alone or in combination with a statin medication. Research is developing constantly, and now there is also a fortnightly injection that has become available called a PCSK9 inhibitor. However, this can only be prescribed by a specialist at present. It is very important that you see your GP if you feel you're experiencing any side effects of these medications, rather than deciding to stop taking them yourself. If you would like any further information, please take a look at our separate videos and/or check out the links above. Thank you for watching this video, and goodbye.